Hello, I'm Anne French and I'm the Associate Dean for Marketing Recruitment in the School of Health and Life Sciences. And I'm joined today with Will Short, who's the course leader for Sports Therapy and Rehabilitation, and Alison Innerd, who's the course leader for Sports and Exercise Science. Thank you for joining me today. We've got some questions that we'd like to have a chat with you about. Just some frequently asked questions that applicants who are interested in studying sport at Teesside often have some queries around what type of course they should apply for, what opportunities they have, and notably, what's the difference between sports and exercise science and sports therapy and rehabilitation. So I thought today I'd just put some frequently asked questions to you, and if we can have a chat that will try and help really unpick the differences between the two courses that might help people in the decision making, if that's okay. So Will, sports therapy and rehabilitation, can you tell us a little bit about the course and what it's involved?
Yes, sports therapy and rehabilitation is all about trying to prevent injuries before they even happen, first and foremost, so we can keep athletes on the pitch and people in work. And then from there, if people are injured, unfortunately, we're looking to diagnose their condition, create a management strategy moving forward for them and rehabilitate them back to full health, whether that would be for the workplace or whether it would be full-on contact sport. Okay. So an example of that would be, typically, we could look to prevent things like anterior cruciate ligament injuries. People have heard of those kind of things. So we might biomechanically screen them and try and spot something in their biomechanics before it happens. But unfortunately, when it does happen, we may be looking to utilise our techniques such as sports massage, exercise and conditioning, some of our treatment modalities such as mobilisations to get them fully functioning back to full health.
So if somebody chose to do sports therapy and rehabilitation, what sort of jobs would they be? Would they have the opportunity to work in? What's their career pathway?
There are numerous pathways, in all honesty. A lot of people tend to go into sport, so they decide to go into professional sport, amateur sport, whether that be football, rugby, they're quite popular ones. Whether they decide to go into sports such as netball, basketball. So that's kind of the sporting slant and the sporting direction that people take. But they do decide to take more of a clinical role, some of the graduates also. So they'll look to go into things like opening their own business, their own injury clinic, or they look to work in somebody else's injury clinic. There are also a lot of graduates going into private healthcare providers at the moment. So where the NHS are outsourcing work to private healthcare providers, and we've got a lot of our graduates going into those areas. There are traditionally the other routes also, such as teaching, so some graduates are deciding to give back and they're going into teaching roles, and they also, obviously, don't forget, they're getting the graduate skills that employers are looking for across industries, multiple industries. So it's quite wide, quite varied.
So it does sound like there's an opportunity to work in a variety of different areas, not just focusing on sport.
Yeah. And we do have graduates that do multiple roles all at once, so quite versatile.
Okay, thanks Will. And Alison, what about sports exercise science?
Yeah, so sport and exercise science, it's a little bit different to sports therapy, because sports therapy tend to focus more on injury, as Will said, whereas sport and exercise science, we look at the full sort of spectrum of sport and exercise science. So a lot of people, when they hear sport and exercise, they typically think of performance sport, maybe working with elite performers, which that is definitely one element of sport and exercise science, and we do have a strong focus on that, looking at the physiology, the biomechanics, thinking around psychology. But we also focus on the exercise element of sport and exercise science, which has a much more of a health focus. So thinking about how can we use exercise to maybe prevent chronic diseases. So thinking about using exercise maybe before people might have a chronic disease, or how can we use exercise to prevent people maybe with a chronic disease. So for example, if someone has diabetes, or if someone has like a metabolic disease or a cardiovascular disease, how can we use exercise to help prevent that and sort of cure those illnesses. So we cover that whole health spectrum, but we also look at a bit more around health promotion. So we often tell our students that there are a lot of jobs in sport and exercise, and there's a lot of jobs at that performance end, but there's also now a real vast number of jobs in health and thinking about how can we improve the health of the nation. So thinking about unfortunately, the obesity epidemic that we have. So people go and work in councils, they go and work for local charities, they go organisations such as Versus Arthritis, for example, which is a really big organisation where they might look at prescribing exercise to help reduce the risk of diseases, but also how can we use exercise as a vehicle to improve the health and improve sort of societal issues as well. So thinking about loneliness, mental health, reducing crime. So it's a real big spectrum, and the students find that across the course, depending on their interest, they can almost tailor their assessments a little bit. So if they're more interested in performance sport, they can take a bit more of that route in the assessments. If they're more interested in health and health promotion and working with sort of average Joe blogs, they could tailor the assessments that way.
That's really interesting, because I think when you hear the title Sport and Exercise Science, you immediately think about sport and that elite athlete, performance element to it. But what you're describing is a really holistic, very health-focused element to the course, which is really interesting. And as you say, can provide a variety of employment opportunities in the future.
Absolutely, and we thinking about the NHS, so a lot of our students might go work in the NHS, and there's a big drive from the sport and exercise professionals into the NHS, utilising the graduate skills that sport and exercise science students have, as well as sports therapy, the same skill set, and how can they get the role in an NHS provider to use exercise to help. So social prescribing is a popular thing. So we have some students that come on our course that don't come from a typical, they haven't done maybe PE at school, they haven't done like a BTEC in sport, they might have done health or health and social care, because they have that health focus, so they could still come on the course that way. So it's quite a good spread.
Yeah. That's a really interesting point around the fact that if people haven't done traditionally PE at school, that it doesn't preclude them from actually opting on to a sports exercise science degree.
Yeah, I mean, Will's course will be similar. Our first year, some of it is a little bit of a refresh. So if you have done PE or maybe biology or some sort of science, some of the modules might be a little bit of a recap, but we include things like sociology as well, so there's a little bit of a spread. So depending on where you've come from, the first year, some of it's a recap and some of it's brand new, but we think the balance is about right to get everyone at a good sort of playing field before they move on to second year, where we start to advance things out a little bit further.
Okay, that's great, thank you. So in terms of the facilities that students will get access to, if I can come to you first, Will, what sort of facilities are they able to access whilst on the course?
One of our unique facilities that we have, and it's kind of pretty unique to the sector as well in universities, is the hydrotherapy pool. So we use the hydrotherapy pool for in taught sessions. So we'll look at the principles and the properties of water and how we can use our rehabilitation in that setting. It can also be used for performance measures as well while people are injured. So a typical example of that would be somebody has broken their leg or had major surgery. Once we kind of get them to a certain stage of the injury, which is a couple of weeks, we can get them actually working quite vigorously, quite hard, even with major injuries like that, because we can offload their weight-bearing element. So that's one of the facilities and how we use it. To run through a couple of others, we've got excellent facilities in terms of the gym and the gym equipment, the gym environment, and our students actually get that for free, the sports therapy and rehabilitation students, because we teach them as part of one of their modules, exercise and conditioning, we teach them how to use all of that equipment in the gym, and more importantly, use and coach athletes and injured clients with the use of that equipment. So we, as well as the gym, we have the unique spaces for the rehabilitation, for the land-based rehabilitation, such as the sports hall and the AstroTurf. In terms of diagnosing injuries and biomechanical problems, so causes of the injuries, we've got the biomechanics lab that we use. And we also have our university injury clinics, so sports massage and injury clinics, and we've been recognised with a national award for those injury clinics and how we take our students through that journey with that facility. So it's nice to have that recognition of how outstanding the staff and the facilities are there, and obviously all the students will benefit from that. So yeah.
So do they get to practice their skills with real people then?
They do from week 5 on the programme right the way through to the last week of their degree. So that's week 5 in year 1. They will start off and be actually implementing their sports massage skills, and they will be in the clinic right the way through till the final week of the final year, and they will be adopting their skills that they obtain at each different level. Examples of that would be, as we've said, the sports massage skills that they'll learn in first year, they'll be adopting them straight away on the live public. In second year, they're learning other skills such as taping and strapping, electrotherapy, key strategic rehabilitation skills, strength and conditioning skills that they are taking into the second year, and they'll be implementing those, as well as first aid skills that they will be taking in placement and working externally with athletes. And then in third year, they're learning some real good key fundamental skills such as spinal mobilisations. So they'll be taking them out into the work with the workplace providers and within our own injury clinics to address conditions such as back injuries. You may have heard of terms such as sciatica and things like that. So they'll be looking to diagnose and assess and treat those kind of conditions.
Okay, that sounds like access to a lot of facilities. Really.
Yeah, access to a lot of people,
yeah.
Access to numerous hours of experience and experiential learning, and access to a great kind of array of pathologies and injuries that they will come up against in the real world once they've qualified.
Okay, so very much preparing them for that entering into the workplace after the degree.
Yes, and it may sound daunting, but one of the key recognitions that we had with how we deliver that model and the national award that we received is because it's very much a phased approach. We take them through and they're in-house with us quite a lot in first year, but having access to people, where when they move into second year, there's a kind of 50-50 split, and there will be 50% of their time will be out doing first aid, running onto the pitch and fields of play to assess and diagnose injuries and manage injuries, and 50% will be in our injury clinics, rehabilitation clinics. And then in third year, they spend more time out with a provider than they do with us. So it's that phased kind of ramped up approach where we're slowly starting to leave them go in readiness for industry, but we do fully support from that initial base, and we're supporting right the way throughout.
So you mentioned going out into other areas with other providers. What sort of areas might they go into?
They're numerous and vast, to be honest with you. We have a selection of providers that we have sourced, but we will always look to take on providers that a student may know of. So for instance, football's quite popular with us, and we have connections where we have students going to football clubs such as Middlesbrough Football Club in the local locality. We've got access to Hartlepool United Football Club, York City Football Club, and lots of other more grassroots providers. We're building relationships with up-and-coming teams in the area. From an angle of another sport, rugby's quite a big popular sport as well, so we do have contacts with, again, Middlesbrough Rugby Club, Hartlepool Rugby Club, and we keep developing those things. We have connections with quite big and upcoming teams in terms of women's football and women's sport. Netball's one of the big ones that we have with female sport, so we have good connections there, and we have a lot of students going out with them. So that's kind of, I suppose, from the sporting element, and that's not all there is. We also go out and send students into private practice providers. So it might be local medical centres, it may be GP surgeries, it may be private clinicians that want to take students into their private clinics and take on students to gain experience in that setting. So it's quite a varied mix, really, and we do try and tailor that with the student journey in mind. We try and facilitate them a place with an external provider, particularly in third year. But more importantly, we like them to pick and choose their own journey, so that we can then help that and help ascertain that placement for them. Okay. So it's pretty much a holistic approach that we have, and we've got quite a lot of good key contacts in the industry.
Okay, that's great, thanks Will. And what about from a sports and exercise science perspective?
Yeah, so in terms of the facilities, a lot of them are shared, so our students get access to the strength and conditioning labs that Will was referring to, the hydrotherapy pool, although a little bit less than the sports therapy. But we also have the physiology labs that the students use. So we have physiology modules that actually in first year, the sports therapy students and the sport and exercise students both do that module. So it's actually quite nice for them to maybe speak to some other people who are in sport but not necessarily on their programme. So they'll use our facilities up in the physiology labs where we have an environmental chamber, so we can go down to -30, I believe, and up to 50 degrees. But also our students get access to the opportunity, if they want, to do a vocational gym qualification, as do the sports therapy and rehab students. So a lot of our students might want to go work in a gym. In order to do that, they need maybe a level 2 gym qualification or a level 3 personal training qualification. So we embed them within our course, so the students have access, if they want, to take on that course alongside the degree, which means they can go get employment in the industry right from whilst they're studying. So we have the facilities here to guide them through that process.
That's a really exciting opportunity, isn't it? That they can actually have that added value of coming out with being the ability to work as a personal trainer and to be qualified alongside the degree.
Absolutely, yeah. I mean, and just going back to the facilities there, I mention it when students come on an open day, and obviously you can't see what's around, but when we show the students on a tour, I always tell them, like, what you see is what you get. The equipment that you see, everything that's in cupboards is open for students, and actually the students sort of get priority over staff on research as well. So nothing's sort of locked away that you don't see. And I'll often tell students that if they're going to go on open days, ask those questions of staff and students. Like, that piece of equipment, as a student, do you use that or not? Because sometimes it's there and it looks nice, but they don't actually use it. But for our students here, sort of what you see is what you get. So if you come on campus and you see the amazing facilities, you will have access to those either embedded in your course, or you can book them as well. So our technicians are brilliant in offering additional support outside of the course. So if, for example, you're doing a VO2 max test and you're not quite familiar with taking blood, you can speak to the technicians and you can come in outside of teaching and sort of upskill and practice your skills in that way. So there's lots of access and there's lots of support to the facilities that are around, and that's the case for sports therapy and sport and exercise science students.
Okay, that's great. And in terms of the opportunity for placements, obviously Will's mentioned the sports clinic and everything that goes along with the sports therapy course. What about sports and exercise? Do students get the opportunity to go elsewhere on placement?
Yes, they do. In second year and third year, we have a placement module, and the students have to get 40 hours of placement. And it's a similar setup to as Will was describing. So we have a bank of placement providers that we advertise to the students, and we ask them to express their interest in whether they want to go on that placement or not. But if there's a placement that they already have a connection with, then we can also facilitate that as well. So they do that in second and third year. And we try and encourage, well, we're flexible. Sometimes we'll say to our students in second year, maybe do a placement in a health environment and see how you find it. And then in third year, maybe go to performance sport. So you're seeing the contrast in that workplace setting. So you see that variety, which will maybe help inform where you want to go for your career. However, we have had some students that have gone on placement in second year and have had a really good experience, and they've been asked back by the placement provider, will they come again in third year because they want to continue the work that they've been doing. They've already made a really good relationship and they've built those networks. So we do have students that have gone back in third year onto the same placement, and we're hoping that might mean that when they graduate, they're going to say, well, maybe potentially a job for you. In terms of where our students go on placement, it's quite wide-reaching because we're thinking of sport performance. So Will mentioned a lot of the sports clubs, and our students can go there looking at physiology, prescribing exercise, strength and conditioning. But we also have students that go out in the more public health, so like Public Health South Tees. We have good links with Tees Valley Sport that house our students. And we also have a clinic set up at university now, so a performance and health clinic that's run by staff and students, so the students can work at university on a placement experience. So some students don't feel comfortable maybe going outside the university environment to get that placement experience, so we can offer that in-house and we can give a little bit more support because they're in a familiar environment and they're with familiar staff, and then we hope that in third year they might choose to take a placement outside. So yeah, lots of variety and lots of flexibility, and we hope that means that the students can build their own journey through the degree as opposed to feeling as though they're funneled down one particular employment route.
Yeah. I think both courses sound like there's a lot of tailoring to that individual student, have like a really individualised student journey really through the course. So that sounds really exciting.
Absolutely, and that comes through from our students. So a lot of our students, when they come on campus and they start a course, they often talk about that individual approach and that relationship that we have. You know, we know our students, they know us, we're accessible, we try and understand what they want to do, where they want to go, to help facilitate the best we can, so they become part of a sport and exercise group, not just a student on a course. So that sort of family feel, I think, is quite a strong part, and that's across both courses.
And what about the teams that actually, the lecturers, the staff who work on both courses? Are they still active in the field? Or do they do research? What do they get involved in?
Yes, we do have some similar staff that will teach across programmes on key modules such as biomechanics, and I know that the lecturer I'm thinking of is involved in industry. I'll speak to a therapy perspective or angle on that. We're very proud of our team, with the experience that they've got in industry and the experience that they still have in industry. So we do have staff that are still involved in professional football clubs. We still have staff that are involved with regulatory bodies. So we have staff that are involved with organisations such as the CSP and Sport England. So they're kind of driving the new agendas and the new initiatives within sport. We have staff that are still involved with international sport, and we try to pull our students across to get some experience in that international sport. And we also have staff that are heavily engaged in research. So what they're doing, they are driving forward, again, the agenda for the next lot of learning and the next lot of ways of doing things that are coming through. So that means that our students are getting twofold, really. They're getting experience that is actually happening out there in the industry now in numerous settings across professional sports, and they're also getting the latest evidence, so that's coming through from the research, so they're getting that evidence-informed teaching. So we like to feel that creates the perfect mix really for the next students coming through to be graduates and going out into industry, because both of the professions really, they're underpinned by two key things. One is the knowledge, the second thing is the skills to back up that knowledge, because we're teaching trades, if you like, to go out and work with people and apply their trade to assist people in the sporting setting and the wider healthcare setting.
Okay, that's great. And Alison?
Yeah, very similar. So we have staff that heavily involved in research, and we have two staff that are BASES accredited sport and exercise scientists, and our course is actually approved by BUES as well, which is, we're really proud that the fact that we have that. We've been working hard to get that accreditation. I think it shows the development and the strength that we have in our staff across the full sport and exercise science sort of spectrum. So we have staff that work in performance sport, we have a lot of staff that work in performance sport but with the younger, so more youth athletes, which is just brilliant because it means that they're working with, you know, the future football stars or whatever sport that may be, netball for example. But we do have staff that are heavily involved in research more on the health aspect. So thinking around physical activity and how can we use exercise as a medicine to help reduce chronic diseases, as I mentioned before, but also how can we use physical activity to just improve the health and well-being of different populations. And we do quite a lot of work in a school environment, so quite a lot of our staff work on promoting physical activity in children and evaluating lots of community-based projects We actually have a team of staff working at the moment in a mental health unit, which are really passionate about using physical activity as opposed to medication to try and reduce some of the symptoms of people with severe mental health and mental illnesses. And we're involved in evaluating whether that project works or not, which is a key skill that you can gain as a sport and exercise scientist. So it's research informed, it's hands-on, but it's very much looking at, there's lots of things happen in the community which are brilliant, and your role as a graduate is coming in and saying, does this work? Is it effective? What are the key ingredients that makes that project work, and how can we inform another group and then help improve their service? So we do quite a lot of work around that angle as well.
So, and if a student was an elite athlete, how would they be supported if they came to Teesside?
Yeah, so we have a really great package in place actually for students that potentially, you don't have to be currently elite, it's just showing that you're on a pathway to potentially being a national or an international athlete in whatever sport you've chosen. We offer strength and conditioning, we offer physiotherapy, we offer massage, and we offer they do a little bit of work around working with them as an individual, thinking about how can they balance the training demands but also their academic studies as well. So there's lots of support, there's lots of opportunities using the facilities that you've got here, but also using the staff experience as well. And then we have the Beth Mead Scholarship as well, and the George Friend Scholarship, which I don't know if Will wants to say more about that.
Yeah, no worries. Just moving on from the scholarships, yeah, Beth Mead's clearly an international star now, and she came through one of the programs here at Teesside University, so I feel she's obviously trying to give back for the next lot of students that are coming through. And George Friend is an ex-Middlesbrough Football Club player, and he's done a lot of philanthropic work in the area, and one of the key ways he wants to continue that is to get involved with the university, because he understands that the university is so crucial to the area, and he's got involved to develop his scholarship to support the new football academy that we have here, and that's males and females. So students from either of our programs or across the university are more than entitled to apply for that program, and they can be assisted with the scholarship. What really excites me, if I was to think about our program, is how we are fully engrossed in those scholarship opportunities and the ability for all students across the university to get involved in performance sport. So our students, for instance, get involved with the staff in doing musculoskeletal screenings. So in the industry that's termed medicals. So on the academy that I've just came through, our students are actively involved in doing the medicals on these performers that are coming through, these new scholarship students. So you can see there clearly we've got this collaboration, this mix between the scholarship students themselves and our students directly from the off. That then spills over into them accessing our recovery services, such as sports massage clinics, and if they do get injured, looking at how we can manage their injuries back to full fitness. We also have students pitch side with them, so they'll be doing the run on and looking after them if they do get injured or they get knocks and bumps and things on the pitch, so that we can manage their care from the immediate care setting right the way through. We do have students clearly that are not involved in performance sports, so they have the time to do that. But we do have students as well that are involved in performance sports. So we've got students, we had students in the past who are involved in international rugby, and national rugby, I should say. And we've got students that are involved in national sports such as judo and cricket at the moment. So you can see we're either being part of that supportive service as sports therapy and rehab students, or we're actually engrossed in it from an athlete perspective. So we do have that crossover.
Okay, so thanks Will, thanks Alison for joining me today and to answering some of these frequently asked questions that we get sometimes on open day or through our chat. It sounds that both courses are really exciting, with lots of opportunities to be involved in external activities with providers or placement opportunities, but also internally as well with facilities and also those things that you've just mentioned there with involving with scholarship students. So thanks very much, Will and Alison, for joining me today. Thank you. And if you would like to know more about our courses, then we'd love to see you at an open day.